February is American Heart Month, so it's important to know the warning signs of heart problems so you can make sure to get the care you need and also practice preventative care to lower your risk of future issues.
And joining us now for more in the sponsored interview is Dr. Christopher Valentine, the medical director of Optum Utah. Welcome.
Thanks.
It is Heart Health Awareness Month, and it is a really good idea to know the risks and who could be at risk, because it is the #1 killer in America.
It is. 875,000 Americans die every year from complications related to cardiovascular disease. And so really understanding the warning signs, but then also the ways that we can reduce its incidence is really important for everybody.
What are the most important things for people to know, just to start us off?
Well, I'd say that starting by addressing the risk factors that you have. And I know that for a long time we have talked a lot about really trying to manage a low cholesterol diet. As it turns out, our genetics really have a lot to do with the way that our blood vessels respond to our aging process and whatnot. And so I think that one of the big take-homes is to get your cholesterol checked, because the parents that you picked are really responsible for the risk factors that you're going to have in the future. It's also important to manage other things that we do have control over, like our diet related to our weight, our exercise, and reducing smoking and controlling our blood pressure.
Let's go back to some of the risks, right? Family history is #1. And what else should we be looking out for?
Well, look, like I mentioned, blood pressure is really one that can be very insidious over a long period of time that sometimes goes under-recognized. And so it's important to check your blood pressure regularly, get in with a primary care physician, and take the medications that is prescribed for you if you are hypertensive. That is to say, if you have that
Pre-diabetes also, and diabetes also a risk factor.
Yeah, very much so. And those are also conditions that really you need to have checked by a physician in order to see what your blood sugar levels are, because even before a person develops diabetes, those higher glucose levels in the blood can lead to cardiovascular damage.
And then smoking.
Yes, smoking is probably the biggest one. If there's one single thing that a person could do to reduce their risk, it would be to quit.
Here's something important to know too. Nearly half of Americans have at least one of those key risk factors. So you mentioned age can also be a factor. And where are we starting? Looking at around what age? Is it in our 40s, 50s?
I would say that it's never too early to check your cholesterol level, but I would say around age 35 is where I would recommend people. I put a little bit more pressure to say, we really need to establish a baseline. Same for blood pressure, but with higher levels of obesity in the United States, I think that some of those risk factors are escalating even in younger populations.
Okay, signs of heart disease. 2 that come to mind, a stroke or heart attack.
Yes.
What are some of those signs? Well,
for heart attack, we want to really be aware of crushing pressure in the chest. Sometimes it manifests in different ways. Sometimes it manifests as kind of more of an upper abdominal pain, shortness of breath, sweating, getting very short of breath with exertion. And then with stroke, we're worried about weakness, numbness in the face, difficulty speaking. A lot of times there are these kind of unusual sorts of neurologic symptoms that really require very urgent attention.
Don't wait.
Yes.
Act on that immediately if you can. And let's talk a little more about what we do to prevent.
Well, for all of these types of cardiovascular issues, both stroke and heart attack, again, going back to reducing or quitting smoking, controlling blood pressure, and that includes taking your medication if it's been prescribed for you, and monitoring your cholesterol. And if you do have high cholesterol, there are effective ways to reduce that through medication as well.
Dr. Valentine, how important is it to talk with your family, to know the history? Because a lot of people don't realize, oh, my uncle had a heart disease, my grandparents, and to also speak to your doctor after you speak with your family.
I think it's very important to really understand the breadth of your family history, and do share that with your family, because understanding kind of what their history was like, maybe some of the things that they faced when they had a heart attack or a stroke, could save someone's life.
Yeah, and when you do have it in your family, and you do, and that's in mine, it's important to not be scared, but knowledge is power, and then proceed from there.
That's right, because we have so much more medical technology at our fingertips today, and so many more options than previous generations do, and we really should take advantage of it.
Optum has the answers. They have the doctors. You can talk to them about any concerns, especially during Heart Month, and you can always go to optum.com/Utah for more information. Make that appointment.
All right.
Thank you.
And thank you to Optum for sponsoring this interview.